Myth number 2, drugs are the primary cause of addiction. It's sort of a common trope of the American war on drugs, and indeed the history of drug criminalization in America, that the power that causes all of the addiction and social maladies resides in the drug itself. Think about the way we talk about some drugs, like demon rum, reefer madness. These are just a couple of examples of many that can be pulled from the archive of public announcements that locate the source of the problem in a particular drug. Drugs are presented as having an almost magical, supernatural, demonic power, such that if we let them into our midst, we're sure to be destroyed by them. But again, if you just think back to myth number 1, the fact that most people who use drugs do not become addicted, it becomes clear that drugs do not have this magical or supernatural power to necessitate addiction. In fact, drugs are not the primary cause of addiction. The primary cause of addiction are what addiction specialists call set and setting. Set is just short for mindset or personal psychology, and setting is the social context in which drug use occurs. And we can do a simple thought experiment to see how obvious this is if we just reflect on it. Imagine 2 identical twins. One of them is admitted to the hospital, have a surgery, and after surgery is administered morphine for the pain. Morphine is an opiate. The other identical twin, let's say, experiments with heroin, another opiate, on the street. Let's just stipulate that they are given the same dosages of opiates over the same amount of time. We also know that they're biologically identical twins. It's realistic to imagine the following possibility. Upon leaving the hospital, twin number 1 does not become an opioid addict. Twin number 2 continues to use heroin and becomes an opioid addict. If that's a realistic possibility, it tells you 2 things. The addiction of the second twin is not caused by the drug primarily. It's not even caused by some magical link between the drug and his biology or genetic makeup. After all, he has the same biology and genetic makeup as his twin. It's caused rather by set and setting, by the purpose for which the drug is used, by the needs that the drug is meant to meet. Another way of thinking about the power of a drug in relation to other causes of addiction is to think about the use of other drugs to help recover from a psychoactive substance. This is a story that those of you who've read Johann Hari's book will know. Just 17.7% of nicotine patch wearers are able to stop smoking. Now think about what that means, right? What a nicotine patch delivers to you is exactly the same drug that is delivered to you through smoking or the use of smokeless tobacco. And yet, less than 20% of the people who have that drug administered to them are able to stop their addiction to smoking or the use of smokeless tobacco. That should indicate that whatever explains the addiction to smoking or to smokeless tobacco is not simply the chemical properties of the drug. It's something else about the role that smoking or the use of smokeless tobacco plays in the daily life of a person. And so I think it is a myth that drugs are the primary cause of addiction. Trauma and dislocation, which are among the most important features of set and setting, not the chemical properties of the drug, are the primary causes of addiction. And I'll come back to this issue of trauma and dislocation when I talk about myth number 5. But just bookmark it for now, that really one of the central themes of my talk is that the root causes of addiction are things like the things that Brett mentioned earlier: loneliness, isolation, pain, social disconnection, uprootedness, these kinds of things.